In the airway and breathing course, Johnny and Roy need to talk about bag mask ventilation. It's the final of 4 lessons in the BLS airway unit. And we're going to talk about bag mask ventilation. So, in general, right now, as you sit here watching this, you're a negative pressure breathing animal. That's how we were built. The air goes in where it's supposed to go. The pressure in the chest is negative when you breathe in. That's good. It helps promote movement of blood back to your heart. So your blood pressure, your perfusion is not impacted by your ventilation. Negative pressure is good. And people just ought to breathe on their own. It's just a better thing. However, sometimes we have to do positive pressure ventilation. That's going to have an impact. It's going to have side effects. It may be absolutely necessary that we do it, but it's not without its issues. So, when you create a positive pressure inside the chest, you decrease blood flow back to the heart. That's a fact. When you put air in under pressure, it goes where it wants to. It's going to go where it's easiest to go, and the stomach is where it's easiest to go. So sometimes we have to ventilate, but if we can get around it, if we can go without ventilation, positive pressure ventilation, then our patients can use their normal breathing process. So we're going to talk about rate, pressure, and volume. And so rate is where we get in a hurry. Slow is very good. One breath, no more often than every 6 seconds. Slow down. Low pressure is also good. A good smooth squeeze, especially before you're intubated. If you're just doing bag mask ventilation and you're squeezing hard, air is going in the stomach. You're squeezing low pressure, less air is going in the stomach. More air is going where you want it to be. It's a picture of a valve on the smart bag that we use on our fire department, and it's to help remind us and prevent us from using high pressure. It's not a pop-off valve. It's about flow. We want to breathe smoothly, a smooth squeeze. And then volume, and this is where I really see an area for improvement, at least for our department. We need one hand and half a bag. One hand and half a bag will ventilate a 200-pound patient. If your patient's a little more than 200, you may need that second hand just to deliver enough of pressure for your squeeze, but you're still not trying to empty the bag. And remember that the tidal volume, the amount of air that the patient needs to be ventilated with, is based on their ideal body weight, not their actual body weight. So the guy that ought to weigh 200 pounds, that now weighs 350, his lungs didn't get fat, the rest of him did. So you may need that second hand in order to create enough pressure to raise his heavy chest, but you don't need to empty the bag into him. You need 2 hands, half a bag for that big guy. But one hand, most patients, you can one-hand bag these folks. And that's really what you ought to be working on. So it's rate, it's pressure, and it's volume. So this is one of the most commonly messed up things that we see out there. Just because you've been doing it wrong, or you see some old guys saying, bag him up, give him more air. It just doesn't, it is not the best thing for your patient. This is not opinion, this is fact. This is not us spewing some sort of thing where that's Boone County specific. This is absolutely the standard out there these days. There's been new evidence, there's been some research, and so we ought to get over the past when it wasn't really helping our patients. And this is one of the things we've been doing wrong for a long, long time. So right rate, right pressure, right volume.